So in this video, we're going to be discussing the Leicester lockdown and how slow the government were to react to this. And despite the fact that they say the opposite, but they would say that, wouldn't they? And so here, Leicester lockdown tightens as cases rise. So this is from the 30th of June, which was about Tuesday. So this video got today. So let's have a look at this. So the Leicester and councils around England have only had access to Pillar 1 data as opposed to Pillar 2. So what's Pillar 1? Pillar 1 tests, I believe, are the ones done in hospitals for people with clinical needs, so the people who have been hospitalised generally. Pillar 2 is mobile and drive-through testing, so it's just people that work in, say, care homes and things like that, people who may be asymptomatic or may not feel the full effects of COVID. And so Pillar 2 testing, they haven't released to the public for over a month. Like, we haven't had the Pillar 2 testing. So if you look at the government tweets, which I will put up in post, you will see the government aren't actually talking about what the Pillar 2 tests are, and so that's important, because if we look here at the Pillar 2 testing, so you see these are Pillar 1, the blue, right? So that's all. Oh, the picture's really fuzzy. I didn't realize how bad it was. So if you look here, so if you look at just the Pillar 1 testing, you think everything's under control, but if you look at the Pillar 2 testing, you realize no, it's not under control. It's not even close. And this is daily. I think there's about 60 plus cases, and this is why Leicester's gone back into lockdown, because here, if you look here, you think it's about between 10 and 15 at push, but if you look up here, you realise it's 60 plus. And if we look back at this article here, it does say somewhere. So according to Financial Times, the data for Leicester recorded just 80 new positive cases between June 13th and June 26th. Okay, so 80 new positive cases between that time is pretty decent. It shows that it's not too bad. But Matt Hancock revealed the complete figure for that period is actually 944. So it's over 10 times the number that the council would have thought was the case. And so you can see how bad this is. That this is the Pillar 2 testing essentially. So minus 80 from there, and you have the Pillar 2 tests, and you can see how bad it is. And if we go back to this graphic here, you can see how high the Pillar 2 testing is, because these are people in hospitals. Pillar 1, these are people that are generally been hospitalised because of the illness, right? You see Pillar 2, these are people who are probably younger, who work in things like care homes or wherever. These might be just random people. They've been tested, and look, you can see they've got COVID. And so continuing on, we can see from Dr. Khan saying that up-to-date local Pillar 2 data isn't being given to councils, which is now being given to councils as far as I know of, and we'll get to that in a minute, which leaves them unable to analyse infection rates. So what that means is that how can a council make a decision if they only have access to this data, Pillar 1, as opposed to Pillar 1 and Pillar 2? Because if you're just going off Pillar 1 for Leicester, you're going to be very confused as to why you should go back into lockdown, because it doesn't look that bad. When you have Pillar 2 factored in, you realise, oh no, this is bad. This is really bad. And so we go to here. This is another thing that worries me, is there's no obvious source of the Leicester COVID-19 outbreak. So in other places you can track it to things like a meat packing plant or something like that. But in this case, there is no clear outbreak. So it might be just people who start socially distancing. So here we've got Public Health England saying that the no explanatory outbreaks in care homes, hospital settings, or industrial processes. Its analysis of cases showed more young and middle-aged people in the city had tested positive for COVID than in other parts of the Midlands. And so what that means is younger people carrying it now, and so that means that maybe it's the lack of social distancing, or maybe it's just going to a shop and you catch it and things like that, just being out and about, even if you are wearing a mask and social distancing, and so that is concerning. And we go to our final graphic, our final article here. This is the last one. No, this is almost the last one. So the government first took notice and acted on what was going on in Leicester on June 8th, because we could see that there was an issue. So they're saying June 8th they knew there was an issue, and they sent four more mobile testing units shortly thereafter. So the word shortly is important here, because this is where the government argues semantics, okay? So we should keep paying attention. So this was Boris Johnson's claim in the Commons, but what the Prime Minister didn't mention was that it was 10 days after June 8th that before one additional testing site was open. So it took them 10 days just to open one, and it was 21 days before a total of 4 new testing centres had opened in the city. So it took him 21 days to open these 4 test sites. And so if this is what day would that be? Plus 21, so June 29th. So let's have a look at this graphic here. So June 29th, so you can see the numbers are spiking here and here. This is possibly due to the other test centres, the mobile test centres kicking in. So you see Boris's line here, because depending on how you define shortly, do you define shortly as 10 days and 21 days? In the case of a pandemic, which spreads rapidly, by the way, in case you've lived under a rock and have forgotten this, is 21 days shortly, or is it very long in this case? Because, you can define things different. I think there's a Doctor Who episode where he goes, three, I don't know, three somethings, is three bad. It could be, or it can't be, three earthquakes, bad. You trip over three times, not that bad. I've butchered the reference, but you get what I'm saying. So 21 days in this case seems pretty bad. And so we go to our final article here. So local testing data to be shared with council. So this means that the government does have access to Pillar 2 testing. It does actually know the numbers, but won't tell us. So read into that what you will. Local authorities are to be given access to postcode level data about the number of a number of people testing positive for coronavirus in the areas after it was agreed with the Department of Health. So what that means is councils can figure out where the outbreaks are. So in my case, say my area, say someone here tested positive, you can go in and test other people in the area to figure out if there's an outbreak in this area where I live, and then you could test more people and get them to self-isolate, which makes sense. But this has only been recent. Look, this is from June the 1st, so it's only 3 days ago that they've actually made this data public, which was just embarrassing. In all honesty, it's embarrassing. And so we can see that the government have not dealt with this properly, leading to Leicester having to lock down, because the council didn't have this knowledge. They didn't have the Pillar 2 data which they needed to make this decision. So look, so we can see that the government have not been doing their job properly once again. And so look, I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.